My interest in orthopedic surgery really has come from my interest in the human body and how it moves and works, and certainly my interest in solving problems, particularly in our field when the human body's not moving and functioning the way that we or the patients want for it to. I think that our field of orthopedic surgery attracts female physicians who have an interest in solving very concrete problems of the musculoskeletal system. Traditionally, orthopedic surgery is more dominated by males, but that's changing, thankfully, as more women are seeing how exciting and rewarding the specialty is and how wonderful it can be to care for patients and see such objective improvements in their conditions. I feel really lucky to practice at Hospital for Special Surgery because I'm surrounded by amazing colleagues, not only the physicians with whom I practice and help me take excellent care of patients, but really everybody from the physical therapists who help our patients recover after they've left the operating room, to the nurses on our floors who are helping them in their immediate period of recovery, to the nurses who help us in our outpatients. Everybody here is really working so hard for the singular goal of helping our patients move and function better. I know that that's unique for a physician to feel that way, and really we're so lucky here to have this tremendously engaged and committed staff. I'm really lucky as a hand surgeon here at the Hospital for Special Surgery to practice with a group of really diverse colleagues that includes several women on the hand service, as well as people from all sorts of backgrounds from a race and ethnicity perspective. At the Hospital for Special Surgery, not only do we have a higher percentage of women practicing orthopedic surgeons than the average in the country on the whole, but we have also a higher percentage of women in our training program than in other residencies around the country, which I think is a great sign for the future of orthopedic surgery and its diversity, but also a sign of how committed we are to making our work environment here as inclusive to members of all populations as possible. Mentorship is something I feel really strongly about. I know, particularly as a female entering a field that was traditionally male-dominated like orthopedics, that having mentors who believed in me, who I could see, doing the things that I wanted to do was really important. And I know for our ability to continue to improve the diversity in orthopedic surgery, that mentoring the younger students and even high school students, medical students who are still totally entertaining all fields in medicine, will be really important.